Hello, my name is Dr. Sharif Gerges. I am a registered naturopath in Ontario, Canada, and I wanted to take this opportunity to share with you a quick message about health awareness. Today, I will talk about how can we as naturopaths help you as a patient through naturopathic medicine. To answer this question, I will go through the therapeutic order of naturopathic medicine. As you can see, it is in the form of a pyramid, the base of which represents the most conservative or the least invasive forms of therapy. And as we gradually go towards its apex, the therapies become more invasive than the previous level, so that the top of the therapeutic pyramid represents the most invasive therapy. As I mentioned before, the first principle of naturopathic medicine: do not harm. For that reason, we as naturopaths start by the least invasive therapies, which means therapies with the least adverse effects, but at the same time therapies with proven effectiveness in clinical settings. Such therapies represent the base or the first order of the therapeutic pyramid, and their target is to establish the foundations of optimal health. Examples of such therapies include lifestyle change recommendations in diet, in exercise, sleep, and or work ergonomics. Another example is determining environmental factors like allergens provoking illness like asthma and recommending ways to avoid such triggers. The second order of the therapeutic pyramid works in parallel to the second principle of naturopathic medicine, the target of which is to support the natural self-healing mechanisms, or the NI, or the natural intelligence I previously mentioned. Examples of such therapies are acupuncture, which works through energy channels in your body, or hydrotherapy, which by improving your local or general blood circulation will be reflected on your immunity level, which will be improved and will help you to get rid of inflammatory mediators, which are responsible for signs of inflammation like pain, redness, swelling, by draining them into lymph. Again, the third order of the therapeutic pyramid works in parallel to the third principle of naturopathic medicine. After we, as naturopaths, identify the root cause of your illness, we should target restoration of weakened or damaged organ systems. Examples of such therapies is recommending the use of food as a remedy, like anti-inflammatory foods, to relieve signs of inflammation if it's the root cause of disease, or recommending the intake of food supplements to reverse nutritional deficiencies if it's the root cause of illness. Another example is recommending the intake of herbs, which have proven calming actions on the underlying cause of illness. The fourth order of the therapeutic pyramid works at a deeper, more invasive level than the previous ones. It aims for correction of any misalignment at the level of the spine, lower back, upper back, and or neck, or at the level of the peripheral joints, like the wrist, the elbow, shoulder, ankle, knee, and or hip. Examples of such therapies include adjustments, manipulations, and or mobilizations, as well as physical therapy. The fifth order of the therapeutic pyramid works at a deeper, more invasive level than the previous ones, and it involves recommending the use of natural substances like herbs or nutritional supplements as vitamins and minerals in doses individualized to palliate the patient's illness. But after a full intake of the patient's medical and allergic history, current medications and supplements, as well as the most recent lab work and imaging results, so that to avoid any interactions with the patient's current medications or supplements, and or to avoid any allergies or intolerable side effects provoked by them. The sixth order of the therapeutic pyramid, which is pharmaceutical palliation, is shared by medical doctors, nurse practitioners, and also naturopathic doctors who have prescribing rights and or IV infusion therapy rights, an extra license which is required from the College of Naturopaths of Ontario to have such practices. As previously mentioned, before prescribing pharmaceutical medications, a full patient intake should be done to avoid any interactions with other medications or supplements and to avoid any allergies and or undesirable side effects of such pharmaceuticals. Finally, the seventh order or the apex of the therapeutic pyramid, which is high force intervention, is only shared by medical doctors and surgeons. This is the most invasive intervention with the most expected adverse effects. Examples are antibiotic prescriptions with their expected adverse effects on gut flora, the good bacteria in the gut helping with digestion and absorption of nutrients. And another example is surgery, which its expected side effects like intraoperative bleeding and or postoperative pain or surgical wound infection. Thank you for watching my video. Please follow my channel and share it with your friends. If you would like to learn more about naturopathic medicine, please feel free to book your free 15 minutes exploratory visit or phone call. The clinic address and contacts are in the first comment. It's time to help someone in need.